Thank you. I want to thank Representative Osinski for introducing this legislation. I want to thank the members of the committee for scheduling it for hearing promptly. I have already submitted a resolution passed by the Libertarian Party of Delaware State Board in support of HB 150. I would like to use my time instead to address some of the issues raised by Representative Collins, in particular regarding the alleged association between psychosis and cannabis use. While there may be an association, I'm not familiar with the research that he was citing there. He did not even claim in his that it was a causal relationship, that using cannabis caused the psychosis. Instead, it could much more likely be the other way around, that people who have mental health issues are going to be far more likely to be self-medicating using cannabis than the general population. Also, in regards to the costs associated in the legal versus illegal markets, the illegal market is not without its costs either, although it doesn't have to pay licensing fees per se to the government. You could argue that there are licensing fees and there are taxes that are paid to the other parts of the cannabis market, except their drug gangs. There's also spillage, which in the legal market refers to product being damaged and product being stolen. In the illegal market, spillage is also product being stolen, but it's by, again, other gang members and other criminals, as well as law enforcement. I'm not comparing them to criminals, but they are also confiscating this product, which creates a risk factor that needs to be priced into the illegal market. It also creates an artificial scarcity that increases the prices of the product that will not be confronted by the legal markets. They will have proper mechanisms for enforcement of contracts, going to courts and whatnot, rather than going to a gun, and that will be a marked improvement over the situation in society, in that we don't have that associated gang violence with the illegal market. But it will also reduce the prices of the legal market as compared to the illegal market. And while I am not, as a libertarian, a fan of the taxes and regulations and licensing fees, I have every reason to assume that they will be able to be competitive with the black market, because they will not have that uncertainty, that risk, that artificial scarcity, and the other negative externalities that are associated with the illegal market.
Thank you, Chair Bentz and honorable members of the House Health and Human Development Committee. I speak to you today as the founder and board president of Doctors for Cannabis Regulation, or DFCR. DFCR is the nation's voice for physicians dedicated to the legalization, taxation, and, above all, the effective regulation of cannabis in the United States for adults. DFCR has hundreds of respected physician members in nearly every U.S. state and territory. As physicians, we believe that cannabis should never have been made illegal for consenting adults. It is less harmful to adults than alcohol and tobacco, and the prohibition has done far more damage to our society than the adult use of cannabis itself. Many capable advocates will speak to the harms of cannabis prohibition, especially to Black and Brown communities, so I will focus on issues of public health. Now, let me be clear. As a physician who follows the evidence wherever it takes me, I believe that cannabis can have negative health effects for at-risk populations. However, the negative health claims cited by some of the speakers today were factually incorrect and directly contradicted by available evidence. They come straight from the talking points of a well-funded opposition that cherry picks and distorts evidence to fit their ideology. But despite the hyperbole of the opposition, we must recognize that cannabis can do harm. The fact is that cannabis can be harmful to pregnant or breastfeeding women and people living with psychiatric disorders, and all legalized cannabis should carry warnings stating so. Also, cannabis, alcohol, and other drugs may adversely affect brain development in minors. But cannabis prohibition for adults has never prevented underage use nor limited its availability. The government's own statistics show that 80 to 90% of 18-year-olds consistently reported easy access to the drug from the 1970s until recently. In the past few years, as more states legalized cannabis for adults, points of access have reduced. The rate of underage cannabis access is now trending downward, and it is currently below 80% for the first time in decades.
afternoon, Chairman Benson, members of the House Health and Human Development Committee. My name is Zoë Patchell, and I'm the Executive Director and Co-founder of Delaware Cannabis Advocacy Network. We ask that you please vote yes on HB150. Cannabis legalization has reached the tipping point. 14 states, including our neighbors New Jersey, have now legalized adult-use cannabis, and 19 other states, including all the Mid-Atlantic states, are taking substantial steps to eliminate civil and criminal penalties for cannabis and convert their pre-existing cannabis markets into economic development generating and job-creating cannabis industries that will go a long way to aid in the pandemic recovery. Delaware doesn't exist in a bubble, and it's just impractical, illogical, and fiscally irresponsible to think, especially at this point, that cannabis prohibition will ever eliminate cannabis from Delaware or stop people from consuming it. Therefore, the only responsible decision to make is to legalize cannabis for adults 21 and older and pass this common sense measure that employs robust measures to prevent underage sales, as well as rigorous consumer safety protections to ensure that the products that are sold here in Delaware are safe, none of which can be done with the illicit market. The arguments repeated by opponents of legalization are often overstated, misleading, or hinged on the false premise that no one is currently consuming cannabis and that legalization creates something new that doesn't already exist. According to the Substance Abuse and Mental Health Service Administration, Delaware has a rather large pre-existing consumer base with 18.5% or approximately 145 Delaware adults admitting to consuming cannabis. If the problems opponents claim actually existed, we would already see them occurring in our state. New York State Department of Health released a comprehensive report that concluded the positive effects of a regulated market in New York State outweigh the potential negative impacts. Areas that may be cause for concern can be mitigated with regulation and proper use of public education that is tailored to address key population. The idea that there's somehow an increased illicit market is absurd and illogical. Cannabis legalization has taken billions of dollars of revenue out of the hands of the criminal market. To suggest that the cannabis market is somehow larger than this and to advocate to keep this huge lucrative market in the hands of the illicit market is irresponsible, willfully ignorant, and a huge public safety issue.
Good afternoon, Chairman Bentz and members of the House Health and Human Development Committee. My name is John Sybert. I live in Ocean View, and I'm Vice President of the Delaware Cannabis Advocacy Network. I ask you to please vote yes to HB150 advancing through this committee. The legal cannabis industry has reached the mainstream. It is no longer considered controversial. This is evidenced by New Jersey's new industry and Virginia being close to repealing its prohibition laws. HB150 will position Delaware to be competitive in the Mid-Atlantic region by being at the genesis. With an already existing market, millions of dollars of revenue would shift from the illicit market to a well-crafted, nation-leading industry. The law would create thousands of industry jobs, as well as jobs in secondary industries such as construction, electrical, HVAC, accounting, legal, manufacturing, security, tech, agricultural, real estate, and tourism. The timing couldn't be any better for COVID-19 relief. In addition, across Sussex County, many young people are facing the decision whether they should enter the family farming business. With the cannabis industry, we can create jobs for those farms and ensure farmland stays generational in the rural areas of the state. I also believe that by implementing this economy, we are sending a message to the youth that there will be a cannabis farming industry to inherit. We can show them that there is a lot of hope in a post-pandemic economy. Prohibition has been a failed and costly policy and does nothing to reduce the cannabis consumer. 14 states and Washington, D.C. have ended this failed policy. The majority of Delawareans agree that removing from the illicit market and creating a thriving, inventive cannabis industry is a better future. The real question is, who do you want to control this market, drug dealers or the citizens of Delaware? Thank you.
Good afternoon, Chairman Bentz and members of the committee. My name is Laura Scherer. I live in Wilmington. I am the Executive Director of Delaware NORML and a proud advocate for our local cannabis community. I ask you to please support House Bill 150. Adult use cannabis legalization is a matter of justice. Cannabis prohibition is a failed, costly policy that diverts law enforcement resources away from serious crime and puts unnecessary strain on our criminal justice system. In addition to the monetary cost associated with enforcement, cannabis prohibition comes at an unjustifiable human cost. According to Delaware Statistical Analysis Center, in 2018, over 5,900 Delawareans had a police encounter for possession-only cannabis offenses with an appalling equality along racial lines. As mentioned by the ACLU, in Delaware, Black people are 4 times more likely to be arrested for cannabis offense than white, which is slightly higher than the national average. Racial disparity in arrests increased between 2010 and 2018, despite our state decriminalizing cannabis in 2015. Passage of this legislation, HB150, will protect over 145,000 adult cannabis consumers in Delaware from arrest, civil citation, seizure of property and currency, and threat, stigma, and lifelong consequences of being subjected to the criminal justice system. The ongoing enforcement of cannabis prohibition financially burdens taxpayers, encroaches upon civil liberties, engenders disrespect for the law, and disproportionately impacts our communities of color. It's time for Delaware to become a leader in sensible cannabis policy and end this failed prohibition that continues to exist as a tool to perpetuate systematic racism by targeting and devastating already marginalized communities in our state. For these reasons, I strongly urge you to support House Bill 150, both today and when it comes before you in the full House chamber. Thank you for your time.